name is Peyton Twilling, and tonight I'm going to be talking to you about the reasons why you should not use tobacco products. According to the CDC's website, between the years of 2009 and 2013, around 660,000 people were diagnosed with tobacco-related cancers. Of those 660,000 people, around 343,000 people died. According to medicalnewstoday.com, tobacco-related diseases kills around 480,000 people per year in the United States. As human beings, we need to realize that tobacco is a harmful substance, and we do not need to use it. If we realize this, then we can save numerous lives, and numerous families do not have to be without their loved ones. It doesn't matter how cool you think smoking or chewing tobacco is, because it can be deadly. Tobacco use can have detrimental effects on the body, and that should be reason enough not to use those products. One of my close family members has fallen victim to the detrimental effects of tobacco use. I'm going to be telling you my first-hand experience of having a family member who has been affected by tobacco use. Tobacco use via smoking can have detrimental effects on the body in many ways, both from the tobacco itself and from the smoke entering one's lungs. Chewing tobacco, another form of tobacco use, can be just as damaging as smoking can be. My father is currently battling oral cancer as a result of tobacco use throughout his life. Let's get started by talking about smoking. Smoking is the most common form of tobacco use in the world. According to medicalnewstoday.com, smoking can increase the likelihood of having a stroke by 2 to 4 times. A stroke can then lead to an aneurysm, which if ruptured, can be fatal. Smoking can lead to coronary heart disease, and heart attacks are twice as more likely to happen in smokers than in non-smokers. Smoking can also lead to a number of autoimmune diseases, like Crohn's disease and arthritis. Smoking has also been linked to type 2 diabetes, and smoking has a lot of bad effects on the lungs. It's been known to cause COPD, emphysema, and chronic bronchitis. Smoking also has really bad effects on your mouth because it can cause gum disease, bad breath, loss of taste, and stained teeth. Women who smoke while they are pregnant can have the following complications. That includes premature birth, miscarriage, stillbirth, low birth weight, sudden infant death syndrome, or SIDS, and infant illness. Smoking can also cause infertility in women, and it can cause a decrease in a man's sperm count. Smoking can affect the skin by prematurely aging it by 10 to 20 years. Smoking has been known to cause the following cancers: mouth, larynx, pharynx, esophagus, kidney, cervix, liver, bladder, pancreas, stomach, and myeloid leukemia, as well as many others. The second most common form of tobacco use is chewing tobacco, which is either done by using dip or snuff. According to medicinenet.com, chewing tobacco can be just as bad or worse for you than smoking. More nicotine is absorbed into the body when chewing tobacco than when smoking. Chewing tobacco has been known to lead to many cancers, especially oral cancers, including cancer in the cheeks, gums, lips, tongue, and cancers in the roof and floor of the mouth. Chewing tobacco has also been linked to pancreatic cancer, esophageal cancer, and stomach cancer. According to the American Cancer Society's website, chewing tobacco can cause leukoplakia, which is a patch in the mouth that is usually a grayish-white that can become cancerous. Chewing tobacco can also lead to bad breath and stained teeth. Chewing tobacco can cause high blood pressure, heart disease, increase the likelihood of having a heart attack or stroke, and it can increase the risk of complications before or during labor if you are pregnant. You may hear all of these complications and all of these risks associated with tobacco use and completely disregard them because you think, oh, I'll never be affected by tobacco use, and I'll never face those detrimental effects. But you can be affected, whether it be indirectly or directly. My father has recently finished treatment after being diagnosed with cancer earlier this year. In May of this year, my father was diagnosed with oral cancer after finding a spot in his mouth and consulting our family dentist. After numerous doctor's appointments, it was determined that the best course of treatment would be surgery, followed by chemotherapy and radiation for 6 weeks, every single day. On August 13th, my father went into surgery at Emory Hospital. He required a tracheotomy and feeding tube during his stay. My father had his final radiation treatment on October 26th and his final chemotherapy treatment on November 6th. Since then, he's had a rough time eating and has only been able to drink protein shakes. As a result, he has lost over 30 pounds since his surgery. My father had a relatively good outcome compared to most patients. It was originally thought that my father would have to have a portion of his cheek taken out that would then be repaired by a skin graft taken from his arm. Luckily, none of that had to happen. Over the past few months of taking my father to doctor's appointments, I have seen patients that have had to have portions of their jaw removed as a result of this cancer. My father's oral cancer was most likely caused by him chewing tobacco throughout his life, though some of the people that we have talked to got it from smoking or alcohol consumption. People need to realize that the damaging effects of tobacco use are real, and they are not rare. If we realize this, many lives can be saved. I do not want anyone to go through what my father had to go through. Even if you do not use tobacco products, you may know someone that does, and you can urge them to stop using them. No one wants anything bad to happen to them. So why do we continuously disregard the warning labels on tobacco products? Imagine if tobacco use completely stopped. Think of all the lives that would be made better, if not saved. The fact that we have to face is that if tobacco use does not stop, the number of people that are crippled with tobacco-related disease will only rise. And the number of fatalities will only rise with it. Today, I urge you to stop using tobacco, or if you do not use tobacco, to encourage someone else to stop using it. We have the solution to stop unnecessary deaths and diseases in our world. We need to put that into action. What kind of world will there be, and what kind of future will there be for a society that is crippled with tobacco-related diseases? Thank you so much.